COVID-19. What should I do if I feel sick? If you've been exposed to the coronavirus or think you have, and have a fever or symptoms like a cough or difficulty breathing, call a doctor. They should give you advice on whether you should be tested, how to get tested, and how to seek medical treatment without potentially infecting or exposing others. Should I wear a mask? The C.D.C. has recommended that all Americans wear cloth masks if they go out in public. This is a shift in federal guidance reflecting new concerns that the coronavirus is being spread by infected people who have no symptoms. Until now, the C.D.C., like the WHO, has advised that ordinary people don't need to wear masks unless they are sick and coughing. Part of the reason was to preserve medical-grade masks for healthcare workers who desperately need them at a time when they are in continuously short supply. Masks don't replace hand washing and social distancing. How do I get tested? If you're sick and you think you've been exposed to the new coronavirus, the C.D.C. recommends that you call your healthcare provider and explain your symptoms and fears. They will decide if you need to be tested. Keep in mind that there's a chance, because of a lack of testing kits or because you're asymptomatic, for instance, you won't be able to get tested. How does coronavirus spread? It seems to spread very easily from person to person, especially in homes, hospitals, and other confined spaces. The pathogen can be carried on tiny respiratory droplets that fall as they are coughed or sneezed out. It may also be transmitted when we touch a contaminated surface and then touch our face. Is there a vaccine yet? No. Clinical trials are underway in the United States, China, and Europe. But American officials and pharmaceutical executives have said that a vaccine remains at least 12 to 18 months away. What makes this outbreak so different? Unlike the flu, there is no known treatment or vaccine, and little is known about this particular virus so far. It seems to be more lethal than the flu, but the numbers are still uncertain. And it hits the elderly and those with underlying conditions, not just those with respiratory diseases, particularly hard. What if somebody in my family gets sick? If the family member doesn't need hospitalization and can be cared for at home, you should help him or her with basic needs and monitor the symptoms, while also keeping as much distance as possible. According to guidelines issued by the C.D.C., if there's space, the sick family member should stay in a separate room and use a separate bathroom. If masks are available, both the sick person and the caregiver should wear them when the caregiver enters the room. Make sure not to share any dishes.